MRI is seldom used in the emergency department, but when we use it, we really need it. It excels in visualizing soft tissues, especially ones that are very delicate, like the brain matter and the spinal cord. IV contrast can be given, which enhances the visualization of the soft tissues. It's also important to note that MRI is not ionizing, meaning it does not cause harm like the CTs or X-rays. So it can be used in patients who are pregnant or for those who have some contraindications to do CT. The thing is, MRI is not available everywhere. It's a very expensive machine and it takes a long time to scan one patient. So we don't really use it a lot in the emergency department. It is also magnetic, meaning if the patient has some implants or anything that is metal, they cannot undergo MRI. One of the best uses of MRI in the emergency department is detecting early strokes. As we know, stroke will cause ischemia to the brain tissue, and when it comes to nerves with ischemia, time is really of the essence. The sooner you discover it, the sooner you treat it, and the less complications you'll have. In fact, MRI can detect the strokes within literal minutes of it occurring. So if a patient presents with classic symptoms of stroke, but you have some doubt, or there is some relative contraindication to starting the blood thinning medications, you can do MRI to confirm the diagnosis of stroke. It is also important in cases where there is severe head trauma that is not reflected in the clinical examination. For example, if a patient has some severe head injury with a lot of abrasions and gouges in the head, but they feel fine or they don't feel that they have something wrong, you can do MRI to detect the very small changes that occur in the brain. It can detect any axonal injuries or microhemorrhages. In a lot of cases where patients have chronic low back pain, especially associated with lower limb numbness, the spinal cord can be affected, and this can be very well visualized using MRI. As not only the MRI can see the spinal cord itself, but it can also differentiate it from the CSF around the spinal cord. So you can identify the areas of spinal compression very well. And this cannot be done with simple imaging like CTs or X-rays. In cases where a patient has severe headache that is chronic, and especially ones that do not respond to a simple analgesia, MRI can be used to identify other causes of headache. And this can be evident in cases like early meningitis or encephalitis or some brain abscesses. Patients who have some seizures, especially the first-time seizures, they can have some MRI imaging, and this can identify areas of brain scarring called gliosis, which can be the triggers of seizures. For these patients, the earlier the diagnosis, the better the treatment. For patients who have chronic neurological symptoms that are not explained by simple imaging, or if they have some neurological symptoms that are not reflected by labs, MRI can be used to identify areas of the brain and the spinal cord that appear heterogeneous, unlike the other surrounding brain or spinal matter. And this can be very good in treating multiple sclerosis or diagnosing multiple sclerosis. Also, if the patient has some chronic or some acute abdominal pain that is unexplained or very abnormal, you can do MRI to visualize the soft tissues in the abdomen and spot any minor or small changes. This lecture is part of the emergency medicine course. If you find it useful, you can check out the entire course in the link in the description. The course covers everything that has to do with the emergency department, including tests, imaging studies, common cases, and serious conditions. We also have a lot of cases and quizzes that you can take to test your knowledge. Just check the link in the description.